Story 1. Sure, but the devil is in the details. What circumstances? Mental competence? Age restrictions? For example, a depressed teenager or a person suffering from dementia. Can you specify conditions ahead of time, or do you have to be mentally competent on the day of? Story 2. It is absolutely considered humane for suffering animals but not at all for humans. That is simply too large a gap. Then there is the death sentence as a punishment, which is intended to be quick and painless for the same humane reasons. It is absurd that there is no system established for humane euthanasia in 2025. The best-case scenario we have now is what? Pull the plug and let a person suffer carbon dioxide poisoning? Who would actually choose that over nitrogen? Ridiculous. Story 3. Everyone has their own time given by the Lord Himself. No one should ever have control over death, for themselves or for anyone else. Story 4. We do not have a choice in being born, so we should at least have a choice in when we want to die. Story 5. If it is legal for pets, it should be legal for us too. There are many other arguments in favor of it, but this is my basic point. We do not get to choose when we enter the world. We should at least be allowed to choose when to exit if we so desire. I have yet to see a single convincing reason against it that does not involve implementation and oversight. Everything else is an appeal to emotion. The arguments against it are extremely weak. Story 6. Yes, people deserve to die with dignity. Ancient warriors knew that. Modern politicians do not. Story 7. Because I believe in bodily autonomy for everyone, I am not God, and it is not my place to tell someone when their time is up. Story 8. Yes, I have a family member with a genetic disease that turned them into a vegetable and prisoner of their body within a year, before which they were 100% normal. Every time I see them, it seems to be a fate worse than death. They cannot move or talk, and they have to eat through feeding tubes. This has been going on for a few years. Possibly runs in the family. If I experience the onset of symptoms, I will immediately move somewhere assisted suicide is legal because there is no way I can live like that, if that can even be considered living. Story 9. I am generally against it as I have concerns about how it would be used. It would have to be something approved by professionals. I think that if a person is terminally ill, in pain, and nothing can help, then I can understand the wish to end one's life. However, I would always be concerned, especially in places like the United States, that a person could be persuaded to end their own life for the good of the family, because it means they will not bankrupt their family with medical treatment and bills. If someone is elderly and has a chance of leaving something of value, then what is stopping them from being persuaded to end their life because it is easier than risking everything on care homes and so on? I know these are extreme examples, but how many people have taken their own lives simply because they thought it was best for their family? Legalizing it would at least prevent those who need it from dying unexpectedly and alone. Story 10. Yes, people should have a right over their own bodies as long as they are not harming others. You may need to wait up to a year depending on any underlying conditions. Your condition should be reviewed by a qualified team of medical and psychological professionals if it is sooner. In cases where nothing is clearly wrong, you should be asked at regular intervals if you want to proceed, and you cannot change your mind even once. Story 11. It is basic bodily autonomy. What control do you have over yourself if you cannot control whether you live or die on your own terms? Story 12. Yes, we have a right to die law in California, which I appreciate. I don't know if people should be able to go to their local pharmacy and get euthanasia medication, but it definitely should be more accessible. It is an odd thing to need someone's approval to end your own life with dignity. Story 13. Yes, but it has the negative side, of course, we all know. Story 14. No, I believe that it should be legal in all countries except Bahrain. Story 15. Yes, there are too many of us. Life is not as precious as some people insist it is. If someone wants out, let them out. Story 16. Yes, sometimes it is the best outcome. We keep prolonging the suffering of terminally ill patients in hospitals who are ready to pass, but they need to wait for months to draw their last breath. Mental illness is still a taboo. Some people are just too sick to function and they want an escape. It should be an option for them. Story 17. Absolutely agree with it. Of course, there needs to be oversight and procedures in place, so you cannot just end it on a whim because you have had a breakup or something. I primarily see it as a kinder way out for terminally ill people and others in similar situations. Story 18. I would only support it if it is illegal to charge for any services related to it and if there are serious crackdowns on anyone who tries to get around it. Complete and total non-profit. Story 19. I think it is wrong that we force people to live through pain and suffering, so yes, it should be legal. Story 20. We need to stop tracking suicides as firearm violence so both issues receive the respect and treatment they deserve. Story 21. Yes. Some diseases absolutely ruin the quality of life. Chronic pain causes the brain to deteriorate, and consciousness or awareness is diminished. People who become dangerous because of their delusions result in fewer unstable individuals on the streets, fewer depressed people who do not want to be saved, and less trauma for those who know them by offering a decent, non-gruesome way out. Story 22. No. As a Canadian, our experiment with medical assistance in dying has failed to the point where government-licensed healthcare professionals and providers are recommending medical assistance in dying for people suffering from extremely curable and treatable conditions, such as depression, or as an alternative to getting treatment for minor disabilities, which the government would have to pay for due to our public health insurance. Medical assistance in dying has become a way for the government to minimize healthcare costs by suggesting anyone with a health problem that would cost more than medical assistance in dying should die instead of getting the treatment they need. If the argument is to die with dignity, people should first be given the chance to live with dignity. I understand and sympathize with people with late-stage, painful terminal illness, and on that principle I do not disagree with medical assistance in dying, but it has become a tool for government economic decisions, and that outweighs all, in my opinion. Story 23. Yes, I was born without my consent, so I have the right to leave in a painless way if I want to. Story 24. I think it should be legal in places where the government, systems, and community can be trusted not to misuse it to harm people. It is legal where I live, and I am happy with that. If I were living in North Korea or the United States of America, where legal protections have been lost, I would not be comfortable giving the government that power. Story 25. I personally support it. If a person's quality of life is such that it would ease their pain or reduce the burden on the family, it should be allowed, with approval from medical and psychological doctors. We allow do not resuscitate orders and the withdrawal of life support. Why not allow people to choose how to end their life instead of suffering through it? My dad is in serious physical and mental decline. He is in his own personal hell with no outlet for his suffering. I believe he would choose to go out on his own terms rather than remain in a perpetual state of delusion and be confined to a wheelchair. Story 26. Yes. We are just as much animals as the animals we humanely euthanize. Story 27. Most states in Australia have legislated voluntary assisted dying with strict regulations. Someone seeking it must have a terminal condition that 3 doctors agree will result in death within 6 months. While this is a step in the right direction, some medical conditions are not terminal but result in zero quality of life. Additionally, some terminal conditions may take longer than 6 months to cause death and cause significant pain. Story 28. We are allowed to euthanize an animal at any time, with or without cause, simply because we feel like it. However, it is illegal to honor the wish of a human being capable of communicating, "I am done. I need mercy." This is deeply wrong. Story 29. If we allow people to choose how they live, we should also allow them to choose how they die. Story 30. If all conditions are met and the people studying the case and giving approval are legitimate, and if we can finalize the terms and conditions in implementation, it will be absolutely helpful. Story 31. To avoid abuse, a country that allows euthanasia must be sufficiently developed first. As far as I am concerned, only a few countries in Europe are civilized to the required level. The rest of the world is still in the Dark Ages, mostly ruled by religious groups. Story 32. Absolutely. It is cleaner than people doing it themselves. I hope I never find someone who did it. Story 33. Because the final freedom is the right to die, death should be faced without suffering and with peace whenever possible. Story 34. Basically, yes, but the details need to be clarified very precisely. The risk of abuse is very high. Story 35. Yes, because I have seen what happens when it is not an option. Watching my father use it a year ago was hard, but the idea of him having to wait another few weeks is unacceptable. Story 36. Absolutely. Because I do not believe in forcing someone to suffer if they do not want to. Story 37. If you cannot choose how to end your own life, is it really your life or the government's? Story 38. This question is complex. Most people would say yes, but the details of undue influence are important. In countries where it is legal, assisted suicide has become a specialized service. I do not think this is something that should be advertised or sold. Story 39. I support limited rollouts for people with incurable and terminal illness. I cannot and will not support it for anything else. Suicide is not something I judge people for, but I prefer it be left to the individual. Introducing death as an option into a system already affected by perverse incentives, pretending that a doctor could ever objectively judge the livability of a life, and encouraging suicides that may otherwise not happen is not something I accept. Story 40. No, for moral reasons. It would pave the way to a society in which elderly people would feel the expectation of others to choose euthanasia, so they are not a burden on their family or society. This is very dangerous territory. It is terrible that some have to suffer physical illness, but others could be pressured into this decision for emotional or psychological reasons. It could even be possible for a young person to seek this therapy to address depression or emotional distress. Story 41. I am in a country where it is legal, and that is a reason I will always keep my own nationality. I feel it is a right humans should have when there is no way out of suffering. In my country, it is mostly used for people with terminal and incurable illnesses. There is a thorough process, so you cannot just say, not happy, kill me, or something like that. I know people can get euthanasia for mental reasons, but there is a years-long process for it. Doctors can also opt in or out based on their own beliefs. I grew up with it being legal, so it would be strange for me to say no, but I think it should be a human right. Story 42. Euthanasia should generally be legal and available in at least one country in the world. Why is there no developing country where euthanasia is licensed? Story 43. Yes, but only in the cases of doctor-assisted suicides. I do not believe in the death penalty because murder is wrong, even when the government does it. Story 44. Yes, people should have the right to choose to end their lives with dignity. Story 45. Yes, people should have the right to end unbearable suffering on their own terms, with proper safeguards, of course. Story 46. Yes, I think it is cruel to force someone to die a painful death when we could simply end their suffering. We allow our animals a peaceful passing when the time comes. We should do the same for each other. Story 47. No one should be forced to live a life of misery or pain. Story 48. Yes, death with dignity should be a human right. People who let their loved ones suffer because of at least they are still with us are monsters. If someone wants to die, let them, especially if they are terminal and have no chance of recovery. If they want to cling to hope, by all means, I am not going to tell someone to give up. But if the choice is between suffering for weeks or months or simply giving someone a triple dose of morphine, give me the quick and painless end every time. Story 49. Why not? Everyone should be able to choose their own destiny. Story 50. I feel like it would depend on the situation. I am from Canada, and we have medically assisted suicide here for those who are terminally ill. I have a friend whose mother had multiple sclerosis and cancer. In early 2024, the cancer was becoming more aggressive. My friend's mother had come to terms with the situation and chose medically assisted suicide. She passed away in March 2024. If it is more a case of mental health issues such as depression, I feel other options need to be offered and used to the best extent possible. Of course, this can take time and a lot of resources. Story 51. Yes. It is absurd that animals have better protections against suffering than humans. Dying without pain should be a basic right. Story 52. Yes, but it would have to be very regulated to prevent murders. Story 53. Yes, but there is a very long list of requirements before it can be approved. Edit. Yes, because I would not want to be dying with pain. Story 54. No. For this to work, you need both strong health and legal systems. Otherwise, it is just too exploitable. Story 55. It should not be legal in Vatican City so they can show the world how coherent they are. Story 56. Yes. People should have a choice about when they leave, since we were not given one about being born. Story 57. To be clear, euthanasia is not the same as assisted suicide. Assisted suicide should be legal within certain limitations for mental health, meaning an individual should at least attempt treatment before choosing to end their life. Euthanasia should only be legal in cases such as brain death, which is already legal to some extent. Assisted suicide means, I want to die, and a doctor helps you. Euthanasia is usually defined as someone else deciding that a person should die because they are suffering, and a doctor agreeing. Story 58. I firmly believe that if you qualify for hospice, you should have the right to choose physician-assisted suicide for the sake of self-determination. Story 59. Yes. As long as the person is of sound mind, they should be able to control their own life, including its end. Story 60. Yes, we all came into this world without the input of the government. We all have the right to leave it as we see fit as well. Story 61. Yes, but there should be a delay between applying and the actual end. 1 month would be enough for a person to avoid making an impulsive decision. Story 62. Yes, why should people be forced to live a life they do not want if there is only suffering left? Otherwise, people either suffer and lose dignity or are forced to commit suicide, possibly with help, which can lead to legal trouble for loved ones. Story 63. It should be legal if people want it. Adding all countries makes it sound intrusive. Story 64. I don't know about all countries, but in America, I think it should be allowed. When you watch your parent revert back to being a baby and not knowing who anybody is, I think it is humane. Story 65. In certain circumstances, the problem is that there will always be those who use this option for their own benefit. My partner died from motor neuron disease, the poster child for euthanasia. Yet he fought right up to the end. That was the correct choice for him. Now my own turn draws near. I hope that I will find a way before I become incapable. Death is nothing to be afraid of. Suffering is. Story 66. I mean, how are you going to outlaw it? But also, once the youth go to a different continent, they are no longer in Asia, so what about them? Story 67. Yes. People should have an option to die with dignity. I have worked in end-of-life care and looked after people who have suffered agonizing deaths. It is absolutely heartbreaking for them and their loved ones. I have seen some traumatizing situations. I will never understand how we can euthanize animals to prevent their suffering but do not do it for humans. That being said, it should be restricted and controlled, limited to those with 6 months to live, to ensure that it is not abused. Story 68. Just saw my grandmother for the last time today. I won't have the opportunity to visit her for months. She is 93 years old with a brain cancerous tumor. She wants to leave this world. She cannot read, speak, move properly, or even watch TV. She is alone with her thoughts in a white room when we do not visit her. Sadly, nothing legal exists to help her end her suffering. She is suffering, and our family is suffering. It is such a shame that in the time we live in, we cannot simply help her rest peacefully instead of enduring this pain for an unknown length of time. Story 69. Yes, because people should be able to decide when they die and do so with dignity and without causing trauma to others. If people morally or religiously oppose it, then they do not have to participate. Story 70. I feel that while people deserve the right to die, it is unbelievably easy for the politics of it in corrupt nations to become really terrible very quickly. I do not trust North Korea and many other countries to effectively create policies around who is and is not considered for euthanasia. Story 71. I do, but I want there to be safeguards in place, obviously. A mental evaluation, a discussion with loved ones, and aid to put any financial affairs in order, etc. You cannot just decide you are done after a bad day or week and act on it immediately. Story 72. Setting euthanasia aside, I do not know if I am comfortable saying that something should or should not be legal in all countries. Story 73. No. I think that you definitionally cannot give consent to it according to the freely given, reversible, informed, enthusiastic, and specific model. When you look at the reasons why people want to die in practice, there is at least structural coercion caused by capitalism, and people feeling like they are a burden. In Canada, the disabled sometimes receive euthanasia before housing. In the United Kingdom, there could be a situation where transgender people cannot get hormone replacement therapy but could get euthanasia if they severely self-harm to the point of being eligible for assisted suicide, if the law passes the House of Lords. This speaks volumes. Is it reversible? Probably not, since once someone is given a lethal injection, they cannot change their mind if they suddenly regret it. In cases of botched euthanasia where the lethal injection causes pain, it should be noted that at least some United States states use the same chemicals for euthanasia as they do to execute people, the latter of which is more widely known to sometimes be torturous. I certainly do not think you can say it is reversible or specific without absolute knowledge of what, if anything, comes after death. This is a religious claim on which the state should remain neutral. For a state to say that you can give informed and specific consent is to take a stance on religion, which it should not do. For example, if someone truly believed they would go to heaven but ceased existing or expected to be reincarnated as a bonobo but got reincarnated as a parrot, well-informed and specific consent this would not be. Or imagine someone thought they would achieve nirvana but instead ceased to exist or, worse, went to hell. If something like these were true, then some people would not truly consent. This is similar to someone saying yes to sex expecting one thing and experiencing something else. This would be rape. I will grant that maybe consent to dying can be enthusiastic, although I find that very uncomfortable. I do not think it is unreasonable to say that if you cannot consent to euthanasia, it should not be legal to euthanize you. The questions about life after death will always make consent impossible, even without capitalism coercing it by refusing to provide people with the palliative care they seek. None of these fundamental objections even begin to address other practical issues, such as the problem of suicide contagion. Discussion of suicide generally causes rates to rise, and legalizing euthanasia will cause general suicide rates to rise from non-euthanasia sources. There are also problems like medical professionals quitting their jobs because they do not want anything to do with it, and people feeling pressured into it out of fear of being a burden. If euthanasia should be legal everywhere as a human right, that would include arguing for it to be legal in Gaza. Legalizing euthanasia there would accelerate genocide, and this alone should be reason to think euthanasia is not a human right if it aligns your aims with the genocidal Israel Defense Forces. The same argument applies to any other country with ongoing genocide. Historically, the Nazis claimed euthanasia would be voluntary. Capitalist advocates for euthanasia propose little better when structural coercion arises from people being unable to have housing without fear of homelessness, unable to access medical care, or unable to avoid starvation. The lives considered unbearable suffering overlap closely with those unable to generate capitalist profit, which says a lot to me. Story 74. Yes. After living through dementia with my father, he always said he never wanted to live that way. The brilliant person I knew was forever gone after his stroke. He lingered for a year at a memory care facility. I know he would have included euthanasia in his advance directive if it had been legal. Story 75. Yes, please, even for mental health. It is cruel to force someone to live in misery just to make yourself feel better. Selfish. Story 76. Imagine if Donald Trump, instead of deporting everyone, just said, eliminate them all. It would be much more interesting to hear how his supporters defend his actions. Story 77. Depends. Not for suicidal individuals or those who can recover, but for people who have no chance, absolutely. Story 78. In my culture, I can foresee society pressuring people to death against their will, so no. Story 79. Within certain limits, yes. But no doctor should be obliged to perform the procedure if they do not want to. Story 80. It is not for me to say what all countries should do, but I would like it if every human had the opportunity to take control of their death as well as their life. Story 81. I did not choose to be alive. I should be able to choose when I die and have an option that is less traumatic for other people. Story 82. Yes, because free will should be a basic human right, and choosing the time of our death and under what conditions is the only civilized approach. We are all going to die, so we might as well get comfortable with it. Story 83. If my dog is too old and frail to walk, she cannot eat or her health otherwise deteriorates and she is suffering, I can have her euthanized by a veterinarian to put her at ease and end the financial burden. Why should we not do the same for people? If humans become too old or damaged, we often prolong the suffering until death finally comes, all because some individuals who believe in magic and fairy tales think a deity will be displeased with our deaths. The same being or beings that made us mortal in the first place. Euthanasia should be a right everywhere. Story 84. Euthanasia is incredibly context-dependent. Most human euthanasia treatments are not the most ethical, but neither is allowing someone to suffer needlessly. Story 85. Yes, someone with incurable cancer should not have to suffer just because people think it is better for her to die slowly and in pain from something horrible. Someone with an inoperable brain tumor should not be forced to wait for it to kill them. If someone is going to die from a medical issue, then let them die peacefully before the pain worsens. Also, I believe a life sentence is a burden on society at large because of how the prison system works. If they do not get to be free and instead rot for more than 60 years on taxpayer dollars, then just kill them. Kill all child rapists while they are at it. Story 86. Yes, people deserve the right to choose a dignified end to their suffering. Story 87. Yes, it should be because no one should be forced to live against their will. Story 88. Yes, it is a human right to die when we want to and in the most humane way available. Story 89. Legal. I think that demanding every nation introduce legislation tomorrow would be unreasonable. It takes strength to have the organized compassion and kindness required for the process to be anything other than gruesome. Why? Because suffering is wrong, and freedom means having the choice not to go meekly into dementia if there is a calm alternative. Why not? Because there might be despair and injustice or a lack of care, investment into cures, social justice, or human rights. Because it may become a way to eliminate those whom society has failed. Story 90. There is a significant debate about this in Canada right now. It is now allowed for mental health diagnoses. Story 91. It should be for people who know they have a short amount of days left to live or are in critically severe conditions. If you are neither of these, you should still be offered therapy sessions. Story 92. We have just had a national debate in the United Kingdom, specifically around a proposal to legalize assisted dying, which covers both euthanasia and assisted suicide. Before it started, I thought it was an absolute no-brainer. Of course, it should be legalized for all the reasons discussed here. But the more I read the ongoing debates, the less sure I became. In particular, there were many arguments against it from disabled groups and individuals who were worried about the potential for abuse. Impatient relatives encouraging grandma to do it so they can get the inheritance. Hospitals with an eye on the bottom line persuading patients to save the National Health Service money and release their bed for someone else. Many of the arguments were about the specifics of the bill presented, but that just underlined my final position. I still support the right to die in principle, but framing legislation around it, putting in sufficient safeguards against abuse without making terminally ill people and their distressed relatives jump through administrative hoops is very difficult to do in our current political setup and probably most others too. Story 93. Yes. I do not think it should be totally easy to qualify for, but I think it should be available. People should have the right to choose to die with dignity if they are terminally ill and do not want to deal with that decline. Story 94. Many people in these comments seem to blur the line between euthanasia and assisted suicide. I can fully support assisted suicide because the individual kills themselves with the assistance of a prescribed lethal drug. Euthanasia becomes complicated when a person might not be able to clearly communicate their wishes. Prior documentation, such as a healthcare directive, is necessary, but even that can be unclear at times. Additionally, the person administering the lethal drug risks breaking laws against murder, depending on local regulations. I hope counseling and other support are available to anyone considering either option, but these choices should not be heavily restricted. I would much rather people have the option to end their lives peacefully than face more unpleasant alternatives. Story 95. I am all for countries making up their own minds. I think my state should allow it. You all do whatever you want in your own states and countries. Story 96. How would this be enforced? There are countries where women are considered property rather than people. Instead of focusing on euthanasia, there are much bigger global concerns. It baffles me that it is legal to end your own life. What are they going to do? Arrest you? Story 97. I feel the right to die should be universal. There are some diseases and ailments that are worse than death. You will go through things no human should ever have to endure. No one deserves to live through that. I think if the bad days outnumber the good days, you should have the right to end your own life. As others have said, we do it for our pets all the time. No one wants to. We want as much love as we can get from our pets. But there comes a time when their quality of life is more bad than good, and we love them enough to end their suffering. It should be the same for the humans in our lives. Story 98. Yes, we treat our dogs with more dignity than our elders. Story 99. I do. In addition to what others have said about how we euthanize pets but force humans to live in pain, it could potentially help people who need organs but cannot find a donor. Story 100. People can be coerced or persuaded into being euthanized and having their organs harvested for profit. This practice can contribute to the economy. Story 101. Slowly dying a painful death because someone somewhere believes their imaginary friend said to kill is wrong? Religion dictates much of what is considered moral, but it is absolutely immoral to let people suffer slow deaths instead of a dignified one. I believe in allowing people to choose how they die. Story 102. Yes. Why force needless suffering when merciful options are available? In the United States, we are kinder to our pets than to our family members. There should be some medical diagnosis and counseling to ensure the person has truly attempted other options, such as mental health support. But for conditions like terminal cancer and Alzheimer's disease, people should have the dignity to choose the time and place where they end their life. Story 103. I have stage 4 cancer. It is treatable but not curable. In my future, maybe next week or next decade, I will hear the terrifying words hospice care. I have some dignity now. I live in pain and know that pain will only get worse. I do not want my children, wife, and loved ones to watch me die a slow, suffering death when there is no hope. I do not fear death. I do fear pain, but worse. I fear the pain I will burn into my loved ones' hearts and souls as they watch me die in pain and can do nothing but turn away or die inside with me. Story 104. My only problem with euthanasia is an elderly person being persuaded by a relative or making the decision because they fear being a burden on their family. However, as long as the person is capable of thinking clearly and making the decision on their own, they should be permitted to do so. Story 105. It is obviously ethical but very difficult to implement. Who holds the final authority to say this person can die? If it is just the person, how do you know they are not being threatened? Could be a doctor, but the entire profession is dedicated to saving people, so it would be very difficult to make that decision. Politicians? Definitely not. But let's say you create a whole job market just for approving people to die. How do you oversee it to make sure they are not making bad decisions? It is a very complex issue to allow people to die. Story 106. I have a couple of friends who plan to spend time in Canada to apply for medical assistance in dying in their twilight years. 2 of my parents' neighbors and one of their neighbors' sisters have already opted into the program too. In my opinion, everyone should have it available to them. Story 107. We introduced it here in Victoria, Australia, about 10 years ago. It is only for terminal illnesses and requires many approvals from doctors and psychologists. It is a dignified process to help stop pain. My grandpa died before the law was in place and spent the last few months of his life barely able to breathe with a cancerous throat tumor. He said he would have taken the medication and ended it all after his radiotherapy failed to stop the cancer. We treat dying pets better than dying humans because we can recognize when terminal illness is just dragging out pain. Whether or not someone chooses active euthanasia is up to them, but the option should absolutely be available so those who are suffering can exit this world without enduring their last painful breaths. Story 108. I moved to a state in the United States with a Death with Dignity Act, especially for this reason. Story 109. For terminally ill patients or patients who are suffering and will never improve, I do. Story 110. Absolutely. As a nurse, I see patients suffering every day. We need to acknowledge our mortality and understand that choosing to die can be a valid and dignified option. This acceptance can significantly ease the burden of enduring prolonged suffering from terminal or severely debilitating illnesses. Confronting the reality of death in this way can empower us to face it with clarity and compassion. Story 111. I am of two minds. Obviously, humans deserve the right to die with dignity. However, we have seen what has been happening in Canada now that medical euthanasia is legal. For example, if you are a disabled veteran who has been petitioning the government to install a wheelchair ramp to your house for 4 years and have not received assistance, you may be suggested to consider ending your life. Giving any government or private corporation the legal power to recommend death to people is likely to result in a nightmare scenario. Story 112. Absolutely. Most of us have watched a loved one slowly progress towards their final breath in unnecessary discomfort. My mother and father both suffered from cancer, and both times their doctor told them with me present, "You know you have the morphine to make you more comfortable." Clearly a nod towards assisted dying. I am very sure my father took the option, though my mother passed while we were holding her hands. Story 113. It's hard because you can die with dignity that way, but there is also dignity in fighting to survive. I am the type of person who would feel bad if I did not even try. I do not care if others do not try, but I would like to. Story 114. Yes, it should be. I know someone with severe chronic pain and fatigue. There is no real cure, and she suffers every single day. She talks about suicide sometimes. That should be an option for her if she ever truly decides that enough is enough. Story 115. Absolutely, because everyone deserves self-autonomy. That being said, I am aware of the implications for people not of sound mind, and countries that do have euthanasia have strict guidelines. Story 116. Yes, provided the person themselves wants it and is not facing pressure from others. I am definitely in favor of it where people are facing a long degenerative illness or a chronic condition that will never improve. I am not completely convinced on mental illness, though, based on myself, where there are times I definitely would have used it, but the feeling always passes eventually. Still, I suppose people should have the right in their own lives. Story 117. It should be legal. The only reason it is not is that if large numbers of people chose euthanasia over living, governments and individuals would have to ask themselves why those people would choose that over the life they were already living. Story 118. I do. They legalized it here in Canada. Some feel it is not restricted enough, while others feel it is too restricted. What is shocking is how many want it. Story 119. Yes, if you are of sound mind, then how you end it should be your choice. Story 120. Personally, yes. But at the same time, put pressure on the state to maintain proper coverage and healthcare for anyone living with a permanent or terminal illness or disability. I would support having at least 2 meetings with psychiatrists and therapists who are knowledgeable about the situation motivating the request. This debate is happening in France, where they are discussing a law like this while also reducing healthcare support for disabled and chronically ill people, including lowering coverage for certain chronic conditions. Given the wording of the law, people affected by lifelong conditions and disabilities are largely against it, citing the issues mentioned above. If the person is unable to give consent at the time when euthanasia should take place, I would say yes, if that person has previously expressed their wishes regarding when and under what circumstances it should be authorized, or has designated a representative to speak on their behalf. Story 121. It probably should not be legal in Vatican City. I have a lot of feelings about the Catholic Church, but I think forcing them to legalize euthanasia in their largely ceremonial microstate seems mean. All the other countries, yes. Story 122. Yes. Your body, your choice means from birth to death. If you want to die, you should be able to die on your own terms. Story 123. I want to die as much as the next person, but I do not want to live in a world where identity theft or misplaced paperwork could result in me being euthanized. Story 124. Yes, because people should have the right to end their life when continuing would be worse. However, it would need a lot of regulation to ensure everyone choosing this does so freely. Story 125. It is my life. I should be able to decide when I wish to end it. Story 126. Yes, but there are serious and well-founded concerns about euthanasia being pushed on people who have disabilities. People with disabilities often experience mental health challenges related to feeling useless and like a burden. This vulnerability could easily be exploited to encourage individuals to request euthanasia for the convenience of others. Story 127. As long as they go through immigration, I do not see why not. Story 128. If there is nothing the doctors can do except connect you to a machine for the rest of your life, I would say yes, as long as there is consent. Story 129. Not only should it be legal, it should be accessible with options on method. In the United States, a few states allow medically assisted dying, but it is not an easy process. I am not talking about getting approval. There should be requirements and safeguards to get approval. However, the method currently permitted is arduous and some people are not able to complete it. You receive a prescription for about 100 pills. You have to crush them yourself and make an unpleasant slurry to drink. Some people cannot do that for various reasons. Physician-assisted death, where a doctor administers the medication through a needle, is not permitted. People should at least be able to get a vial of medication and self-inject. But no, a simple and quick process is not allowed. If I become terminally ill and decide to end my life, I will source my own medication on the black market. Story 130. I wrote my college application essay on euthanasia, and I did the same for graduate school. I have been a strong advocate of this issue for as long as I can remember. There is absolutely no reason why someone should not have the right to choose death. Under certain circumstances, I was very young when my mother told me that if she ever got sick, she just wanted to die right then and there. I never forgot that. Well, guess who got very sick and did not have a choice but to be kept alive? All she wanted was to go, and I wanted that for her so much. It eventually happened, but not before more than 2 years of suffering. After that, I have followed my state stance very closely. It has been in the state Senate for over 20 years. Finally passed this year, and we are just waiting for the governor to sign it, likely before the end of the year. I do not want to go through what she did, and I do not want anyone else to either. Your body, your choice. Am I right? I have similar thoughts on related topics. In summary, yes, it should be legal. It should be your decision what you want to do with your own life. Story 131. Yes, we should be able to choose when we want to get off the ride. No mess, no complications. Story 132. Much like organ donation, it is acceptable on the surface, but you must be very careful about monitoring perverse incentives and downstream effects. It is not as wholesome and merciful when someone emotionally distant decides you are better off dead. Story 133. Yes, I have had 2 grandparents, both over the age of 95, practically begging to die because they had no quality of life. Their deaths were not quick or painless. They lingered for too long and gradually lost the use of their bodies and eventually their minds. It is a terrible thing to watch happen to a loved one. Story 134. Everyone should be able to choose to die with dignity, but the government can take advantage of that to push an eugenics agenda. Now that you can kill yourself, we do not need to pay health insurance for untreatable illnesses, as we have seen in France lately. Story 135. Everyone says yes until it is their loved one doing it. I think it should only be for terminally ill people. Story 136. Yes, we actually have it, but it is a bit different. If you are suffering, you can ask to be put in a coma until you recover or die, which is basically euthanasia. But I wonder why we only have that option. Why can't we just remove or damage the brain's pain center so a person could at least not be on drugs during their last hours? They say it is unethical, but come on. Keeping a person drugged on morphine is ethical, putting them down from their misery is ethical, but removing the pain for the rest of their lives is unethical. Sure. Story 137. No. Euthanasia in the same way we do for pets is not suitable for humans except in extreme cases of unsurvivable injury and brain death. But read further before thinking I am against assisted death, because I am not. It is a problem of definition. There is a lot of nuance in this, and the terms we are using are inadequate to the conversation. Knowingly supplying the means for suicide to someone. Are they medically declared terminal? What criteria? Is it legal to give them options or to advertise or publish the service? Does it require a referral from a healthcare provider? What about supplying items that could be used but have other uses? Is licensing required? Is there a requirement for certification of kits? Keeping someone company who is dying by suicide. Is there a duty to prevent? Is there a requirement to refrain from physical contact or verbal reassurance? Is there a duty to report the attempt or the death? Is there a requirement to make a statement to the police, hospital, or coroner? Where is it legal to do this? At home, in hospital, at a beach, on a trail? Assisting someone to die. What are the requirements? What sort of safeguards should there be? Who must be present to ensure those safeguards are upheld? Where can this happen? Can there be comfort and reassurance given? And are there restrictions? How do the safeguards interact with the reassurances? Where does reassurance cross over into encouragement? Do support people need training to avoid pitfalls? What happens if they make a mistake? Is it still acceptable to call it euthanasia if there is an advance directive from the patient asking for the procedure? The word euthanasia can also mean mercy killing without consent, which is usually the context when used with animals and is not the same thing. This can cause considerable resistance to the idea. So it is a tricky question. Story 138. People who are against it do not always understand how badly a person is suffering. For me, it is a multitude of issues. I have been suffering for decades and have reached a point where I no longer wish to participate in life. Life is painful, lonely, and not much more than an existence. Things will continue to decline and affect my quality of life a little more each day. I did not ask to be born, and I feel that I have fought long enough. I am tired, and it is extremely depressing. The fact is, I could apply for medical assistance in dying for various medical reasons. If I were denied, I could still die in a way that does not provide dignity, and people get upset about that also. It truly should not matter what anyone else thinks. No one else lives my situation or gets to tell me how to fix something that cannot be fixed. We give people way too much control over our own bodies and lives. Story 139. No. We lose something of our humanity by giving ourselves the ability to just shut it all down. There is beauty in life the entire way, however long that way is for us. Maybe it's just that I am a musician, empath, and artistic type, but I see the amazing art from across the centuries which shows how our common human experience bonds over suffering and pain. I see how this commonality makes the hard times not as hard and gives us chances to experience empathy for others in a visceral and meaningful way. Then there is the spiritual side. We completely negate the beauty and dignity of every human life by providing an off switch. People say we allow this for animals, so why not humans? But what they miss is the difference between being a rational animal and just an animal. We cannot deny that we are animals, but we can also see very clearly that the way humans handle suffering is quite different. If we do not let it eat at us, we grow closer to others through suffering. We rely on family, friends, neighbors, and unite and bond with other humans in a way that animals cannot. My religion would say that we have a soul, and there is a spark of the divine in us that makes it all different. Knowing that not everyone agrees with that, I am just going to say that euthanasia reduces us to irrationality in that our ability to process pain, succumb to needing others, and feel helpless at the end of our lives is a path to unity with our fellow humans. Natural death is not pretty, nor easy, nor something anyone looks forward to, but it is noble, heroic, and a portrait of the essence of humanity. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.